today I'm going to be explaining to you guys what medical assistance is, or also known as MA. Excuse the background, we're getting ready to paint, so don't worry about that. But yeah, so what is medical assistant?
So you may be wondering, what exactly does a medical assistant do? Who do they answer to? Well, I'm going to tell you now. So a medical assistant are healthcare work professionals who assist doctors in clinics and medical offices. Even though medical assistants work directly with doctors, they cannot give medical advice to patients. Their duties are limited to collecting information and preparing the doctor and patient for the medical visit.
So yeah, they pretty much work underneath the doctor. They do vaccines, they give injections, which goes along with vaccines. They do vital signs. They work in different departments, whether that be OB, medical wellness center, hospitals even, peds. It's really a lot of places where a medical assistant can work. So yeah, it's really cool. You may be wondering, what exactly is a medical assistant? How much they make? What's the pay? What can I do? What can they do? Where can they work? How much schooling do they have to go through to be a medical assistant? Well, I'm here to answer all of those questions for you. So with me, I went through a medical assistant program for about 9 months now. So what happened was I decided to do hybrid, which is you only go once a week and you pretty much learn by yourself, which was kind of, I'm gonna be honest with you guys, it's really not easy and it's not hard because you're really just learning, reading all kinds of things. You don't have a teacher. I mean, you got a teacher on Fridays, but she's not gonna sit there and explain things to you like a teacher will go on Monday through Friday. So that's only one downside about being hybrid, is that you don't have like a one-on-one teacher that's, you know, going to be there Monday through Friday with you to help you with whatever the topic may be that you need help with. But on Fridays you do lab with the teacher too, so you can ask her questions, what you need to learn, or how to do this, how to administer a vaccine or a Tdap with tuberculosis, just many things that you may want to know how to do. They can help you with that. So I think medical assistant so far is pretty damn cool. I love it so far. I love it. I love it. One thing that I will say, if you don't like shots, then baby, medical assistant and nursing really isn't for you. Like, if you can't give shots, if you can't draw blood, then this is not for you. You need to find you another area of careers, because nursing is all about shots, patients, customer service is a big one. Because if you can't talk to a customer, how are you gonna talk to a patient? It's just the same thing. It's only difference is the patient is not buying things. The patient, you gotta treat your patient like how I do it. I treat my patient like that's my grandmother, that's my grandfather, that's my cousin, that's my brother. So I'm connecting with them. You know, how have you been doing today? What brings you in? You have pain? What kind of pain are you experiencing? How long has this been lasting? Those kind of questions. And you just, you know, you don't want to get connected with, like, you don't want to like build that emotion with them or whatever, because you never know what could happen. So what I mean by building connections with them, like, just like basically treat them how you would treat your grandma or your grandpa. Just that simple. Just don't be mean to them. I know you may have some difficult patients that may come in, you know, really mad or whatever, and they want something done ASAP right there. Sometimes you can't have the right thing right there, or it has to go, you know, be sent to somewhere else, and you have to, you know, order something and they don't want to wait. And you just gotta, you know, understand, be calm, talk to them, let them know what's going on, what can't they do, or, you know, whatever else the case may be. And you just basically talk to them and, you know, let them know, hey, so and so, what is what, you know, it's process, you know, whatever. So I haven't really had a difficult patient yet, but I am still learning. This is something that I really wanted to do a lot besides, you know, YouTubing. I do want to do MA stuff, and I want to, you know, progress and elevate to, you know, nursing school, where it's for my RN. But yeah, RN school. I do want to elevate to RN school and, you know, get my bachelor's degree. That has always been my thing, is getting my bachelor's degree. I really want to get that done. So yeah.
So how much does a medical assistant make? So what I'm seeing here, I see 12 through 23 per hour, 12 through 18 per hour. So what I'm assuming is it kind of just depends on where you go to work at. You may get paid for your experience, how much experience you got, but overall it just depends on where you go and how much experience you got.
Yeah, there's many types of specialties that a medical assistant can work in. You can work in like OB, peds, there's all kinds of stuff. You can even work in like the vision area. However, if you're going to a medical assistant program, well, you know, why would you want to go to a vision place? But that's possible because the MA is an MA. You can do that if you wanted to. So that's one plus about it. So if you really like helping people, and, you know, just being there, helping them, you know, talking to patients, you know, and giving that, if you got the heart for it, well, then this is for you, and you should definitely pursue your dreams, because why not? Sky's the limit. However, now, if you're not a people person, you're isolating yourself, you like to isolate yourself from everybody, you're not very talkative, friendly, sociable, then this is not for you. If you don't like getting blood, sticking patients, not for you. I know growing up, I used to hate thinking about getting injections to somebody or giving them, and now I'm just like, I love it. Like, I don't want to do it all the time. So things can change. You can say one thing now, and then later on, it could be a different subject, different story. So make sure, if this is what you want to do, stick with it and elevate, because it's all about elevation, positivity, baby. So yeah, just wanted to get on here and share with you guys what an MA is and what do they do, who they work under, the doctors, and what they do, vital signs, injections, shots, goes along with vaccines and injections. Depending on where you go, what specialty you go, it may have different procedures. You might wrap somebody's hand, arm, leg, stomach side, you know, whatever else. People coming with the craziest things. So, you know, every day is a different day. So yeah, so that concludes this video. I hope you liked this video. Go ahead and give me a thumbs up, subscribe to my channel, hit the bell button, leave a comment down below letting me know what's your favorite part of this video. If you're an MA, what you like about being an MA, just let me know down in the comments down below. If you have any suggestions or anything else, make sure you excuse this background because we're about to paint, so don't worry about that. So yeah, without further ado, we'll see you in my next upload.